This is a special session. This session is on COVID-19 pandemic, post-pandemic challenges and poverty dynamics in Bangladesh, evidence from SANEM GDI CLEAR project. So I will make the presentation later, and where I'll tell briefly about the project background. But here we have chair, Dr. Sohela Nazneen. She's a senior research fellow, Institute of Development Studies, University of SAEC, UK. She'll be joining online. I'm sure she is already online. And we also have discussant Mr. Yugesh Pradhanan, International Technical Advisor and Project Manager, Livelihood Improvement of Urban Poor Communities Project, UNDP Bangladesh. So what I request Dr. Sohela Nazneen to kindly start the session, and while me and Mr. Yugesh can actually take our seats. Over to you, Dr. Nazneen.
Thank you, Professor Raihan, and thank you to SANEM for inviting me to chair this session. I am the program lead for the program that's on COVID-19 Learning, Evidence, and Research program, which has quite a few projects looking at what do we need to know in terms of tackling the pandemic effects, not just the economic effects, but the social and political impact of the pandemic. The GDI SANEM project is one of those under this particular program, a grant that was awarded to both SANEM and GDI. And this project is innovative in the sense that the way it uses data, particularly database existed previously, and this round looks at what happened next. So have that kind of longitudinal data is a privilege, of course, in terms of looking at multidimensional poverty, but the project is also innovative in the way it uses other methods and the way it focuses on the nature of multidimensional poverty and its impact. So it goes beyond just looking at economic impacts. It was designed to create actionable agenda and not just academic inputs. I'm very excited to listen to the findings about this particular project, because this one started a little bit late given complications around issues when you're setting it up. But the team has done a fantastic job. Professor Raihan will be presenting the results, of course, and the wider implications. But the large team is here, so I can see David Fielding online, Mahtabuddin online, Upasak Das online. But Professor Raihan probably will do a lot more justice in terms of introducing the team. So without further ado, I invite Professor Raihan to take the stage and to give us the presentation. Thank you.
Thank you very much, Professor Nazneen. As Dr. Nazneen said, that we had a research team, and other members of the research team is Professor David Fielding from the University of Manchester, Dr. Katsushi Imai, also from the University of Manchester, Dr. Upashak Das is also from the University of Manchester, and Mahtabuddin, you have already known him. So he is doing his PhD at the University of Manchester, and he's an assistant professor at the Dhaka University Economics Department. So before I make the presentation, I would request Professor David Fielding to say a few words about this project, and then I will get into the survey findings. So over to you, Professor Fielding. The floor is yours.
Thank you very much, Salim. Can you hear me?
Yes, I can hear you.
Thank you. Okay, so as Dr. Sohela said, my name's David Fielding. I'm an economist at the Global Development Institute at the University of Manchester. And over the last 12 months, I and other colleagues at Manchester have been working with colleagues at SANEM on this research project. And this project really builds on a lot of work that SANEM has done already, principally in 2018, when SANEM conducted a household survey across Bangladesh with 10,000 households. And what we've been doing over the last 12 months is to prepare and then conduct a second survey of the same households. And that happened in the later part of 2023. Now, I say we, the practical part of the data collection was organized by by Professor Salim Raihan and the team at SANEM. And I've really been watching that from a distance, and it's been an enormous privilege to watch the SANEM team at work. Over 9,000 households across Bangladesh were surveyed in the space of about 6 to 8 weeks, I think. And the quality of that work is very high indeed. And I take no credit for that. That's the work of Professor Raihan and his team. Is really as good as any work I've seen by organizations like the World Bank. In terms of the quality and efficiency of that data collection that provides us with some very, very detailed data. And I already knew that SANEM was highly respected in Bangladesh for its work, but now I see at firsthand why that's the case. So Professor Raihan is going to be talking about some of the results from our project. And I don't want to steal his thunder and talk about too many of the details. But one thing I will say that struck me very much is that if we compare households in 2023 with households in 2018, so these households who have been through, first of all, the COVID pandemic and then the cost of living crisis, the effect on households is very heterogeneous across Bangladesh in different dimensions. So as Professor Raihan will show, in some dimensions, the effects on the poorest households in Bangladesh have been very much more severe than on the non-poor. In other dimensions, there are large rural-urban differences, and the poor in urban areas seem to have been more severely affected than those in rural areas. And Professor Raihan will talk about those details. But we believe it is really those details that can inform good policy making in any country, but particularly in Bangladesh. Good policy to alleviate the poverty caused by the pandemic and the cost of living crisis. Good policy needs to be based on these details. But of course, one survey or even two surveys is not enough in the long term. So Dr. Raihan is going to present the results of our 2023 survey, but I hope this is just the beginning of more work that we can do to inform policies to alleviate policy in Bangladesh. But over to you, Salim sir.
Thank you so much, David. I think it was an excellent introduction. And as you know that we value the kind of partnership, research partnership between SANEM and the University of Manchester. As Professor David Fielding, he was saying, back in 2018, SANEM conducted a very large survey in Bangladesh in collaboration with the Planning Commission, GED Planning Commission. So we covered 10,500 households. And we did that to have not only look at the poverty dynamics, but also the labor market dynamics. So it was a very comprehensive survey. And then some of you probably remember that back in 2020, we did a repeat survey through telephone because that was during COVID. It was in November, December 2020. So we actually went back to the same set of households. And because of the COVID and because of, that since we used only telephone, we could reach out to around 6,000 households. And then now, in October, November last year, we again went back to the same set of households, and we could success in reaching out to more than 9,000 households. So what we are going to do here, we will be presenting to you, we'll be comparing the results what we had in 2018, and then the results of 2023. We'll not refer much to these 2020 results, as you can see that the methodologies were a bit different in 2020 because it was based on telephone survey, but 2018 and 2023, it was very extensive household survey, enumerator-based household survey. As Professor David Fielding, he mentioned that we tried to maintain the kind of quality of data collection very rigorous way of collection of the data. So in this presentation, what you can see from the title that it covers COVID-19, post-pandemic, and poverty dynamics. So various phases since 2018, especially you can actually identify there are 3 phases. One is the COVID-19 pandemic. That was a phase, and then there was a phase of recovery, especially when the pandemic was kind of getting over, and then was a recovery, economic activities started going back to normal. Then again, there was another shock, this price shock, the global supply side shock and the resultant inflationary shock. So what in my presentation, since we have limited time and we also would like to listen from Mr. Yogesh from UNDP. So if we want to cover all the aspects of the survey, it will take much longer time. Those of you are interested to know the full details of the survey results, I invite you to the seminar conference in the first week of March, organized by this CLEAR project, because under CLEAR project there were a number of studies were conducted, and ours was one of them. So it's a big conference is going to be organized, and some of you who are interested, you can also sign up to listen to or attend the conference. And from our study team, either Professor David Fielding or Mr. Mahatabuddin will be presenting the research finding. So again, coming back to this our presentation today, what I thought that how to make this time more effective and how to make this presentation more interesting. If I start talking about very detailed impact of COVID-19, probably that would not really make the audience interested at this moment, because it's very late now. Kind of, you need caffeine to boost up your energy. But here, I will mention some of the major findings which came out centering around COVID-19 and post-pandemic, the recovery phase. But then I will actually emphasize more on the recent time, especially the price hike and the resultant impact on poverty. So in brief, whatever impacts we'll be seeing on poverty, multidimensional poverty, inequality, all those things we are going to present today. We are going to present some numbers today. I'm not sure, is there any from media here? No media? Okay. So, it would be interesting to have, if there are any media, I'm quite sure that it would have been cited or presented in the newspaper or any other media tomorrow. But since we are late almost in the evening, so probably it will not be covered much. But anyway, so I'll be presenting some numbers, and you can contest those numbers. And then, but I think since these come from very rigorous household survey data, it will make you interested. So I think I have already talked about the background. So let's not get into those slides. Methodology, in terms of methodology. So as I said, that it's a very, very sophisticated, very detailed household survey. The way we conducted the survey in 2018, it was, we actually took help from a very high-level BBS, official of BBS, ex-official, and he actually helped us in designing the sampling. So we targeted 500 PSU, primary sampling unit, and then, as I said, there are 10,500 households we actually covered. And then we had the next round of survey actually in October and November. Then you can see the kind of disaggregation or the the way we distributed PSUs in rural and urban. I don't really want to get into the details, but those who are interested, you can. The presentations. One thing, all the presentations are uploaded. If you see in your agenda, the back of the agenda, there is a QR code. You can just scan the QR code. You will see immediately after any session is over, those presentations are uploaded. And then again, the sampling distribution in 2018, 2023, you can see this by division. The distribution, we tried to make it nationally representative as much as possible, and that's what we did. Some findings on the COVID-19 pandemic, and very, very brief overview of the COVID-19 pandemic impact. On employment and livelihoods, we found that during COVID, there are 54% wage-employed males and 44% females lost jobs during the pandemic. More than 62% are unemployed for longer than 4 months during the pandemic, Around 60% of the self-employed non-agriculture workers had to close their business for more than 1 to 3 months. Crop and livestock producers faced challenges like higher input prices, low price of produces, shortage of labor, etc. And then also there were other challenges like unusual rise of prices, reduction in wages. And what are the major coping strategies? Changing food habits, depleting savings, borrowing, reduced spending on health and education, the kind of very typical coping strategies household undertake during this kind of crisis. And that was very much evident during that time. And we also saw very significant impact on education and healthcare. Very interestingly, when we actually went back to the household this time and asked them to recall the kind of impact they had, and it was very close to what we found in our 2020 study, especially in terms of education, like the online education. It was very poor kind of coverage in terms of online education during that time, and also the kind of healthcare services and other kind of things which we found that was not very success. But there was one success that we found, that the COVID-19 vaccination was for 84% of the eligible population, which ensured at least 2 doses of COVID-19. So that was an interesting success. But now I want to focus my presentation on the recent inflationary pressure and changes in the household food security. So one point I'd like to mention here is that whatever numbers I'm presenting here, these numbers would be a cumulative effect of various shocks. Because, as I said, there are different phases of shocks. So you can see the kind of combined effect of all these things. So how to decompose them, we will be because this is a survey findings I'm presenting here, but we will come up with some more technical papers where we'll try to use some kind of methodology to decompose some of the, effects of inflation or, COVID-19, but we are still working on that. So if we look at the inflationary pressure on the households, so it was around 86% of the household actually, they said they were affected by the recent price hike. And again, the major coping strategies involved changing food habits, depleting savings, reducing non-food expenditure, borrowing, and working overtime. But more importantly, we actually calculated the food insecurity index, or it's called food insecurity experience scale, FIES. And there are 8 questions in that FIES, and that is actually used by FAO in calculating food security index. And we had this question in our survey. For example, one is that were you worried we would not have enough food to eat? And especially in comparison to the reference period, were you unable to eat healthy and nutritious food? Did you eat only a few kinds of food? Did you have to skip a meal? Did you eat less than you thought you should? Did your household run out of food? Were you hungry but did not eat? Did you go without eating for a whole day? So these are, as you can see, as we move from 1 to 8, the severity of food insecurity increases. And the last question is probably whether you actually spend the whole day without eating anything. So, and then we had results for each of these questions, but at the same time, there's a methodology of combining all the results into a single index. So that's what we also did. And the results, what we did, we are comparing 2 periods. One is between, we actually asked, in comparison to 6 months back, in April 2023, what was our situation in October, November in 2023? So that is the 2 period the households were asked to compare, and they actually compared and they provided the results. So now look at this result. The food insecurity at the national level, so you can see that, and we are comparing April is the yellow bar, and October, November 20 is the green bar. And as you can see that is actually worried or unavailable of healthy food, few food, skipped, and in all categories. In the food insecurity increased or food security declined. And if you compare, this is the left side is the national average, and right side is the results for only the poorer households. And you can see that obviously the poorer households were more food insecure than compared to the national average. In comparison to all indicators. For example, the poorer households, the 2% of them said that they had to starve whole day. You know, there were cases they had to starve whole day. Or 19% said in October, November 2023, they had to skip a meal. And 33% they said they had to eat less, which was actually 25% in April. So as our findings is that in all the indicators, the severity is food increased, and then we also found that it was not only among the poor households, but among the urban households, the severity, food insecurity is higher compared to the rural households. So this is the index I was talking about. Using all these 8 indicators, you can produce an index where you can see the secure. That means whether you are food secure, which declined from 40% to 37% for the national average, but for the poorer households, which declined from 24% to 21%. And you can see that the mild food security, moderate food security, or severity, actually severity increased for the national level too. Moderate food insecurity also increased, whereas mild food insecurity declined. But for the poorer household, you can see that the moderate increased quite significantly from 25 to 30, and severe also increased, and that is, compared to the national average, it increased, almost 2 times for the poorer households. And again, the urban households were the major victims. Now, for the numbers on poverty, so what we did, we actually calculated those who were students of economics and attended the development economics course, or how to measure poverty. One very popular way is to use the CBN method, the cost of basic needs approach. We applied the cost of basic needs approach, and we then actually used 20 poverty line income to apply all over Bangladesh, because as you know, you can't apply a single poverty income to calculate the poverty level for overall country, because the price or the poverty income in Dhaka city would be definitely different from the poverty income in Rangpur or Sylhet. So that's what we did, and this is the kind of poverty line income which have been calculated for the lower poverty income and the upper poverty line income. And these are the results. So you can see the national level. So we are now comparing the 2 periods, one in 2018 and another is 2023, because in 2018 we had the numbers, we had the survey, where then nationally the poverty rate was for the urban upper poverty rate, UPL, was 21.6%. We can see in 2023 it declined to 20.7%, around 0.9 percentage point. Whereas that was due to the decline in the rural poverty, but again you can see that urban poverty is actually increased during those 5 years. And for the lower poverty rate, we saw actually both in urban and rural area it declined. But again, there is a reference point to that, because our study was in 2023, October, November, and according to the household income and expense survey of the national, what BBS does, and they did it in 2022, and they found that the national upper poverty rate was 18.7%, whereas actually our rate came out in 2023, 20.7%, 2 percentage point higher. And also in the case of lower poverty rate or extreme poverty rate, we found higher poverty rate in our survey. And that is kind of obvious, because I think when the survey of HES was done, that was in 2022, before this kind of price shock. What is that? Why it is moving? And then I'm not really, because of the time constraint, I'm not really going into the divisional level. But again, now looking into the multidimensional poverty index, also those who have attended development economics, you know this MPI is a very popular measure now. It looks into different components of poverty, and especially the 3 dimensions: education, health, and the standard of living. So we had to make some adjustment, because for the education and standard of living, we had related all the relevant indicators in the survey. But for the health, we had to actually use some proxy data from the survey, and then because of the data limitations, as I said, we actually modified our health indicator. So using this index, what we found, the multidimensional poverty headcount rate, actually for the national level, it also went down between 2018 and 2023 from 25.8 to 24.7, but again, in the urban area, it increased. So the story is kind of consistent with whether you measure, use CBN method, or you use the multidimensional poverty index. So the story is kind of consistent that during this period, in between 2018 and 2023, as I said, there are two big shocks. One is, of course, the COVID-19. Another is the very high price. So the poverty, the reduction rate in poverty was very slow. And you can see there is a poverty rate declined very marginally. And then even it declined, that urban poverty actually increased. So that is something very important area to focus on. And this is also by division. I'm not really getting into that. Inequality, we actually used a measure of inequality. What we compared, so you see the richest 5% and the poorest 20%. So we compared the ratio between richest 5%, poorest 20%, and that ratio actually you can see had increased from 2.1 if you use the income to 5.4 in 2023, and if you use expenditure, it from 1.3 to 2.1. So that means inequality during this phase actually increased. And we found that youth need, you know the need, I think that was been mentioned today since the discussions, not in education, economic activism training. That also increased for both male and female. And what we found that there was a permanently returning migrant workers and 1/3 remains unemployed in 2023. So even in education, I think that was, this is another striking result which came there, which was evident from the survey that more school-aged children, the ages between 5 and 15, were out of education in 2023 than 2018. And that is more evident among the poorer households. And we can see that for the poorest household, in 2018 we found that 70% of the families they had children out of school, and which increased to 22%. And then you can see, that kind of increased, a national level increased, but it is very much coming from the poorest and the second, quartile. And then also the access to healthcare worsened in 2023. So I'll not take further time, I think, because I think I have already exhausted my time which was allocated for me. But again, we found that inadequate social security programs was very much there. Only 37% of the households, they were under any social safety nets program. So I'm not really making any formal conclusion since this is a work in progress. But as you can understand, the numbers actually very striking. It's actually not really very much supporting some of the findings of the official statistics, in the sense that where the official statistics was showing some very significant improvement in reduction in poverty, here we found, since it's a very recent survey, we found that there is a rise in poverty, whether you use the CVN method or multidimensional poverty index. And also very alarming, we found that the food insecurity situation actually worsened across the board, and especially the urban households are the major sufferer. And in terms of policy implications, I think one important area which was very need to be looked at, how social protection programs are addressing these challenges, whether there are adequate social protections in place, programs in place to address these challenges. Because you have seen that the urban households were affected mostly during this time. But if you look at the social protection programs for the urban poor, you will see there are a lot of challenges. I know Mr. Yogesh, he works on the urban poor, and probably he can also share his experience on targeting urban poor, especially when it comes to social protection programs. So I'll stop here and over to you, Dr. Nazneen, to conduct the rest of the session, please.
Thank you, Professor Raihan. That was certainly a very thought-provoking presentation, not just in terms of how we look at the different indexes and the methods, but what are the numbers showing. I know that you're being cautious to draw conclusions from that as of yet, because the analysis is still ongoing and you have further outputs to produce. But just to draw attention to the fact that if we think about the rural-urban divide, if we think about in terms of policy implications and social safety net coverage and who's falling through the cracks, or the challenge of learning loss, particularly how the poor households are being hit, or the fact that we are thinking about food insecurity, all of these put together raises the issue about Bangladesh so far has had a great development story in the way and in the progresses that we have made in social development indicators and also how the economy has been ongoing. But our challenge is already here in terms of sustaining that progress. And what these numbers are showing is that we have to rethink in the way it can't be business as usual. It needs to change. So I invite our discussant, who is from UNDP. He's the technical advisor and the professor and project manager for the Livelihoods Improvement of Urban Poor Communities project. Obviously, his expertise and insights would be really relevant given what the data shows about the urban population. So, Mr. Yugesh Pradhanan, the floor is yours for comments.
Thank you very much. First of all, I really thanks to Sanem to inviting me for role of discussion on this panel discussion, which is really hard for us because I'm working for the urban poverty. And looking the finding, because I'm now giving the two roles. So one is what Professor Salim, I'm currently so what he presented, and then I looked these presentations a little bit earlier also, and some findings, it would be helpful for the discussions, that's what. And also I would like to share how we are working targeting the urban poverty. That might be interesting because there are a lot of students, and what are the materials UNDP has you can also use for your research. First of all, I would like to go on the impact of COVID-19. So UNDP through urban program, the National Urban Poverty Reduction Program, we also did the socioeconomic assessment of the COVID impact. And some findings are interesting, might be for your research will be good. So what we found that around 40% household income decreased due to loss of job, less salary from a job, or non-activity of or lack of activity from small medium business, which is really giving you that fact also. But the one interesting might be for you is due to COVID, who are the non-poor household, they became a poor. Right? That's the interesting, we found it. And in even many of the households who were poor, they became more poor, right? So these are the I think so the gap and the square poverty gap increase in the urban area due to COVID. That might be the very good to also, when you are finalizing your research, might be this study will be also helpful for the COVID impact. But when I see the presentations, I found some query which might be interesting. So 54% of wage employed male and 44% lost job during the COVID-19. And it is good to also share what is the current status of those who lost their job, if it is possible. And for us, like a UNDP, when we are designing the program in the urban, for the urban poverty, it might be interesting for us. And another one is around 60% of self-employed non-agriculture workers had to close their business for more than 1 to 3 months. You have said that. And maybe it is good to do, like if we are giving some the startup business or the support, then what is the average amount of the loss of business capital and income is there? So that might be interesting. And you also mentioned that in education, only 20% of students in the rural and 33% on the urban area had access to online education, which you have nicely reflected. But it is quite interesting. So what is the reason of this digital divide among the rural and urban area, which is the urban area should be more, they should have the access. And what would be the policy recommendations to reduce this digital divide? That might be interesting. So if I go on the poverty, it is mentioned in the research that Bangladesh reduced poverty at the rate of 3% per year since the mid-1980s. So given the poverty condition of Bangladesh, it seems very high. That demands more clarification how this percentage was calculated. Right? So that's the one thing. And another one is poverty rate has increased upper poverty in the 2018 16.3 and 2023 18.7, while poverty rate declined on the lower poverty 2018 6.8 and 2023 5.4% in urban area. What does this mean? So this is a little bit not clarifications. And poverty, like in our program also, we use also a lot of, because MPI is also our program tools for targeting and working for the urban poor community. And it is quite interesting. So, but just I would like to have a query, why MPI poverty has increased in Dhaka and Chattogram, and what are the policy implications that might be. And another part is like when we are talking about the poverty is largely influenced by the access to infrastructure also. So the study could also link poverty status with the accessibility, the community infrastructure. Somehow you mentioned that part, like a lighting, assets, and like that part, and sanitation. But there are also other community infrastructure which can be linked and then measure the poverty. And, but I would like to share something about how we are working, setting or targeting the urban poor community. That might be interesting for you, right? So in our program, we are working in the 19 cities. So when we select the cities, then first we do the, there is a one missing in the, just I forgot, in the Bangladesh, climate vulnerability is vital when you go do the correlation with the poverty. And here is a missing part, that part. And then for the Bangladesh context, the big issue on the climate issue. So how the climate vulnerability is multiple, the poverty condition which could directly link with the study. That was this one. And I'm now again coming back to the program of the UNDP, which you are also interested. So when we are setting the target to work in the urban poor community, first of all, we do climate change vulnerable assessment, because this is a very vital in the Bangladesh, and we do the poverty mapping. Once it is, this understands for the local authority, where we are working directly with the local authority. This program is funded by the UK government and implementing by the local government divisions in the 19 cities, because we couldn't work in the Barisal. And so then we discuss with the community which settlement, which poorest of the poor or the vulnerable community we can go. And then we mobilize the community, empower them, and then we do the MPI registration when they're empowered. So we have the MPI, but in the different scale. So we have the 4 million urban poor people registered as an MPI. And now the local government is using also this MPI as targeting tools, not for only the COVID time they have used it, but also for like in Khulna, there was a cyclone, disaster was there. So then how to reach the most climate vulnerable people who are the most poorest people. And this with this MPI, they have reached out very easily, local government, and provide the prompt services, right? And, but basically here the poverty is also, one is what recommendations should be there, how the poor people should be empowered and work together with the local government so that they are the change agents. They are the solution maker. They are not a problem creator. So this way, if we go that way with the message, and then we are working with the urban poor community. Basically, I don't say as a slum community, like in Korail or Mirpur, where we are working. We don't say slum. We say urban poor. Yeah? And in this community where they are working, they are the one who is making the solutions together with the local government. That's the, I think, the way forward for the Bangladesh also, and to work with to eradicate the poverty. So that's the one thing. And the another one is like a UNDP Bangladesh together with LGD, we have a CBI, Climate Vulnerability Index. This might be also useful to use as a tool as a targeting, how to reach out to at the rural area. It's basically focused on the rural area because in urban area still not work on it. So that might be the useful. And then another part for us, this study will be very useful because we are supporting the government, finalizing the national urban policy. Some on the urban poverty, which is interested, a recommendation might be there, we can take and put in the committee. I'm also part of the committee member. So that might be the recommendation which you are putting over there. We can share this recommendation to our NUP committee meeting. And this will also help us to bringing the research studies connecting to the, for the policy, drafting the policy. That's all from my side. If you have any questions, thank you very much.
Thank you. Those were very interesting comments. I will now ask, we have extra 10 minutes. That's great. Because I was asking that we need to start wrapping.
Sanem and the colleagues in Dhaka for this conference. Unfortunately, I could not be there. I spent 3 months in Dhaka doing a detailed assignment, but my assignment finished on February 15. But anyway, so basically, I think my colleague Yugesh, by the way, hello Yugesh, a lot of very valuable comments. So I just wanted to add a couple of points on the global MPI, because as you know, this global MPI is basically the flagship poverty indicator for UNDP. It's been measured together with the University of Oxford since 2010, and it's basically covering about 110 countries around the world. This global MPI covers 6.1 billion people, so it's not 100% of the global population, but it's a good share, especially for those in developing countries. And according to this global MPI, 1.1 billion people is multidimensionally poor. That's 18% of the number of people covered in by the global MPI. One important point regarding COVID-19, the last report that was presented last year had already few, obviously, for most countries, there is no data on post-COVID, not available data yet. The different sources for the different countries varies. But then in 25 countries, poverty, multidimensional poverty halved in the last 15 years. Some of these countries in the context of COVID-19. So that's actually very good news. That poverty reduction is actually possible even in adverse contexts like COVID-19. In some of these countries, even when they manage to reduce multidimensional poverty in the context of COVID-19, some of the deprivations increased, in particularly education, school attendance. So it is very interesting to see. We didn't actually see the particular, the individual deprivations of the MPI that this study produced, but then we saw the graph on the increase on school attendance precisely. No, so that's a very important finding, and I think that also calls for attention in terms of policy action to attend this increase in deprivation in the context of COVID-19. So let me just say that for Bangladesh, there's actually one measurement based on the survey, the mix, the multiple indicator cluster survey that UNICEF produces for about more than 100 countries. And this survey in the case of Bangladesh is for 2019, so 1 year after. And the good news is that on has scheduled another mixed survey for Bangladesh. So very soon, hopefully perhaps next year, we will be able to actually see some of the findings that we saw today corroborated with the global MPI estimation as well. I think that in the case of Bangladesh, a couple of things very interesting from the 2019 results that are available right now is in terms of the deprivations, the most prevalent deprivations in Bangladesh that are housing and cooking fuel. So I think this, obviously we are making, and we are strong advocates of social protection policies and strengthening social protection policies. But then perhaps these two deprivations, at least from the 2019 results, were very important as well if we aim to reduce further multidimensional poverty in Bangladesh. So let me just finish here. I know that this is the last session and we are running out of time, but I didn't want to miss the opportunity to say hello to the colleagues and the friends in Dhaka. Thank you very much.
Thank you. I think there are a few things that we need to pick up on in terms of what is being discussed, but also the presentation itself. One is, of course, the issue about the new poor that was raised by Mr. Yugesh, but also Ivan mentioned the issue about deprivation and nature of deprivation. I know that there's a lot of debate around learning loss and education, but also what was just discussed around MPI index and what kind of deprivations we are seeing, which the SANEM study highlights, but which is also tied to the issue of it's not just deprivation, it's also depletion of the kind of support that people get. Support from the state, we talked about social protection, but for a lot of the poor, it's also support from family, friends, community that we fall back on. And if everyone is being hit by the crisis, which everyone was during the pandemic, but also the cost of living crisis, then grappling with. So thinking through these issues in terms of then what kind of policy support, what kind of shock responsive systems do we need to design, and also what kind of data do we need, and how different data sets corroborate the story is important. But let's go to the floor. We have about 15 minutes. And Professor Raihan, I'm sure you would want to answer some of the questions, but let's sort of open up the floor to gather as many questions and feedback as we can. So I will need you to be my eyes and ears since I'm not in the room. And if you would moderate in terms of questions that are coming if people have raised their hands. So Professor Raihan, you have controlling power for a few minutes, I guess 10 minutes.
Thank you, Dr. Nazreen. Yes, I think we have a hand here. Professor Bozlo Khandekar.
Questions from the floor?
Yeah, question from the floor. Hey,
reactions?
Okay, thank you, Salim, and the team for excellent work. I have few observations for these your work, and also some question for UNDP colleague. One is that since you have said that, I mean, from your survey, the poverty rate has increased, like almost by 7 percentage point compared to the HIS, I mean, if you can compare 2016 to 2022, that is the HIS time frame. So in that, we have seen that poverty has reduced, like 18.7% for the last in 2022. Now we're seeing from 18 to 23 from the survey, we have seen that poverty has increased actually.
No, overall poverty actually declined.
Okay. Okay.
Urban poverty increased.
Okay, urban poverty increased. In that case, I think both poverty has, rural, urban, both poverty has. So I think this will, like, if you can, I mean, this to talk to the, like, HIS people and try to find out what are the reasons for this difference in terms of your results and their results. I mean, surely they will come back to us, like in terms of asking that why these are differences between these two surveys. The survey size or other are more or less, I think more or less same. So I think that needs to be, I mean, like, if you can put in your final report, that would help. In terms of social protection, I think that none of the HIS is absolutely, I mean, they have a section, but they don't collect social protection data in comprehensive manner. So there are lots of gaps in terms of social protection data. So now, in terms of, like, if you see that,
so.
If you see that the government of Bangladesh is now moving towards universal social protection for 226 upazila, old age allowance and widow allowance. So if you can see separately what are the impacts of those 226 upazila in terms of poverty reduction through social protection, could be an interesting see that you can find out from there whether the universal social protection is actually working there, or what is this, if the finding comes out, we can see what are the implication of this kind of social protection, because currently ADB is actually having a mission tomorrow trying to expand this 500 million budget support they are providing, exactly following that method without possibly undertaking a full, comprehensive assessment of this intervention. So that's very important. The other issue is that in 2016 data, we found that exclusion error was extremely high, 71%. Hopefully you will also can give us some idea about what are the exclusion error. Have they increased in the urban area, rural area? There are differences also, but that is also very important. And I think that comes to the point that possibly Bangladesh government is actually not looking into the major problem of the social protection, the targeting issue, which you are trying to capture from your survey. I mean, now that's for to Yogesh, in terms of your, which are the 19 cities that you are working is one question to me. Other is that, in your methodology, targeting methodology, what are the exclusion error, or how, do you feel that, your targeting is good compared to the targeting that government of Bangladesh, or what is the level of exclusion inclusion error in your, and the third question is that, what are the impacts of your intervention? Are you seeing that well-beings are sustainable, or they are improving or not? Thank you so much.
No, thank you. I think let me answer very quickly to Professor Khandakar's question. And the last question is the exclusion inclusion error. Actually, we are in the process of, comparing and then looking into the creating more cross tabulation. So I think we'll be able to provide some answers to that. About this universal social protection, I think we'll look into our data and look into the upazilas, which are covered under the social protection universal, and we can look into that. But your first question, I think, is a bit complicated, because I think to have a more effective and meaningful dialogue with the BBS, I think is very important. And that's what we also tried in the past too. I'm quite sure that with this study, and that will also create the platform because one important thing is, as I mentioned in my presentation, that the BBS's latest household survey was in 2022, and ours is almost a year or 1.5 years after that, and we actually were able to capture more of the inflationary effect of this. So probably that could explain part of the, partly why that poverty rate was higher in our case. But definitely, I think we'll be able to engage. We won't want to be engaged with the BBS. So, Mr. Yogesh would like to.
Yeah. So one is the impact of intervention, and another one is your targeting methodology. Okay, targeting methodology. So target methodology. Just I repeat it. I'll again repeat that part. So when we take the city or the municipality, so the first we do the climate change vulnerable assessment, because the Bangladesh is the most climate vulnerable. And if you look, the poverty connection is the climate is a one nexus we should talk about. And then second, we do the poverty mapping. So this will give you different settlement or the ward, which is the area we need to do the targets. And together with the local government, we have sitting with all the local government officials in the city corporation and the municipality. And we do the target setting, like which ward, which settlement we should work first. And once we start working, then our initial process will be the mobilization and empowerment with the community. Then we empower them, mobilize them. They will identify their community action plan on the social issue, economic issue, environment issue, basic infrastructure issue. And those are the issues, how they can link in the urban planning process, like at the ward level and the city level. And those are the, some we can support, but all we can support. Then community will choose what we can support. Community will choose what they can do by themselves. Community will choose what they can get from the local authority. And community will choose also how they can get from the other. This is how they are working as a change agents, right, to eradicate their poverty. This way we are doing the work. And if you talk about the impact of interventions, we do the baseline study, and we are doing the inline also. And then this will give us a measurement as an impact. But when you are using the tools like MPI, Multidimensional Poverty Index, then when we did in the one ward, like what was in 2017 and what was changed in 2022 or 23, then there has been changes. Despite like what you said with the economic crisis, COVID, they are slightly improved, not decreased. That's the reason, because it's not only the our project intervention. This like a whole, like how we empower them and how they connect and work together with the other development actors. And if you talk about the sustainability, these are the community platform, 4 million urban poor people who are working in the 19 cities. They have the legal entities, and they are like in town federation, they have a cooperative, they have MOU signing with the city authority and the municipality, and then they have office also at the city authority. And some, after the project also, the city authority and the municipality are retaining the community frontliner with support to the community, working for their issues and to how to mitigate the poverty issue that part. And just I want to touch on the social protection, if you allow me 1 minute. Basically, if you see in the Bangladesh, social protection is focused on the rural area, but in urban is not focused. So what we found in the COVID time, and if you talk about the primary health, access to the health service, rural area, they have the access. But if you talk about the urban poor people, they have a very difficult in the access to the health also. That we found it. And then when, after the COVID, we also did with the socio-economic assessment, we also repurpose our program. For example, we also tried in Naranganj, together with the IB mayor, so how to make a digital health insurance for the urban poor people. With this, we reach out to almost 20,000 people. It's a minimum premium, but this will give a highlight how they work, and then that is a working with the local government. And if you talk about the social protection branding, like in urban, there is nothing there. So we have also different model has been developed, and then when the BNCCs, they are drafting the urban nutrition strategy, they are also using some UNDP best practices in the urban nutrition strategy. This is how we work together. Thank you.
Thank you.
Hope it is useful.
Thank you. So let's have a few more questions. Yes.
Hello, this is Mustafa Mushfiq. I'm studying anthropology at University of Dhaka. As your research suggests that the urban population had the worst hit after the pandemic, and as we have previously seen in the previous economic recessions, the population in the urban people, they migrate whenever they are hit by a economic depression or something. So what is the coping mechanism of this migrated population in the village when they are migrating? How they deal with the poverty? Thank you.
Thank you. I think, okay, let me respond to you because I don't carrying the notebook. Yes, the coping, so the coping mechanisms of many of the reverse migration you were talking about, that from urban to rural areas, actually depleting their savings was one of the important coping mechanisms. Borrowing, we found, and also, moving towards taking more, I would say, inferior jobs. And I think the rural labor market became more and more kind of tightened because of the kind of reverse migration. But our study will look into that, in more details, because as I said, we have presenting just some of the highlights, but it will have a very detailed analysis, and some of the questions what Mr. Yogesh also mentioned, like the dynamics of new poor. We also came up with some of the dynamics, how they are, whether they're graduating or falling back to poverty. But because of the time and because of the focus of the study, we did not present it. But those things, some of your comments will be really be addressed to. Thank you for your question. Yes, here the question.
Hello, sir. I'm Paramita from the Department of Economics, University of Dhaka. So my question is related to the social safety net being more targeted towards the rural population. We can see the urban population is somewhat left out. So would a more targeted social safety net security program would be more better for the urban poor, or should the government or any other regulatory institutions focus more on like controlling the inflation, especially in the food sector, because their food insecurity and the other vices that they are facing comes from the high inflation? So which would be more effective in the short term and the long term?
No, thank you. Of course, controlling the inflation is extremely important. It's not only for the urban poor, but for the rural poor as well. So, but at the same time, why is the need for social protection? One important need is that with your usual economic policies, still you will find some segment of the population who are left behind. Probably with your economic policy, because you heard the discussion immediately before this session with the lecture by Professor Iyanatul Islam. So that's why you need to have different social protection programs. But then the problem with the urban poor is that mostly they are floating population, and they come from different segment of the country, and you don't actually have a very solid address or a very solid root of this population. And we also found that because when we did this survey, in 2018 we had collected their information during our household survey, and we had to track down these households to do the repeat survey. And the most challenging was for the urban households. So you see, and there were some attritions, probably higher level of attritions for the urban household samples in the urban households. So that is one of the challenges. And another thing probably is that in the rural, relates to more the political economy perspective, because in rural population, rural poverty, you may find rural constituencies, political dynamics, which actually favor or facilitate the rural representatives or political representatives to seek for more social protection programs for their people in their own constituencies, but which is kind of fragmented in the urban context. I know Mr. Yogesh also can add 1 or 2 points. Please. Your microphone, please.
If you talk about because I'm the witness, I'm working since last 4 years in Bangladesh. So if the people who is coming, we're calling as urban poor, that is two choices they are coming to the city. One is with the economic opportunity, and the second is a climate-induced displacement. So I have seen a lot of in the Khulna, Sundarban area, how the settlement is vanishing, and these people are coming to the urban center area. Then some relatives they are bringing, and then they are managing. So basically, if you see the issue over there, that is the very serious issue. We find that part. But when you talk about these people, there is no policy for how they can get immediate support. There is no registration systems in the local government. And you are absolutely correct that there is no rule and regulation for the urban safety net. So, but now the government of Bangladesh is working on the policy, and one is social protections, and another is also national urban policy, which also indicate these types of things. So we are working on that, and I hope this will be improved in the coming year.
Thank you. So I think our time is kind of exhausted, and I'm available during the high tea, so I can actually chat with you if you have any further question. But I'm requesting my study team. I know Professor Fielding is there, Mahatab is there, Upasak is there. If you want to add any points related to the discussion you heard, kindly do so. Can I get the Zoom?
Mahatab, you had questions or answers that you wanted to.
Answers. I can go after Professor David Fielding. So I can go after Professor David Fielding says, okay?
Okay, so I don't want to take up too much time, but just to reiterate that the analysis of the data is ongoing, and we will have detailed answers to some of these questions, hopefully within the next month or so.
Mahatab,
go on, Mahatab.
Mahatab, you got 2 minutes. After that,
thank you so much. I only need 2 minutes. Thank you so much. Well, thank you, Salim, sir, for presenting the study in person. It would have been lovely to be there, but joining online is enough. I have just two questions. I answer to two questions I think I can give.
No, you can't have question. You have to answer.
No, answer. Yeah, I have two answers to
okay.
questions from Yogesh and Bozul sir. The answer to Yogesh, one of his questions was how we calculate the growth rate of the poverty reduction in Bangladesh. It's a very simple calculation. We did just compound annual growth rate of the poverty reduction since the mid 1980s to the recent period, and it came out around 2.92%, which is around 3%. And the another just one answer to Bozul sir is that regarding the exclusion error on the social security program that we have collected the data, our estimate is close to the BBS estimate of 2016. We have around 75% of the exclusion error. So again, it's an ongoing process. So still we see that there's a high number of type 1 and type 2 error in the social protection, but still it's ongoing, and we are crunching with the numbers at this moment. So thank you all. Yeah, I'll finish here. Thank you.
Thank you, Madhav, for raising those points. I wanted to thank Sanem on behalf of the CLEAR program, and also GDI for doing such a fantastic study that generates lots of discussions. That's always an indicator of you're hitting something, right? But also draw attention of the participants and those who are online that the CLEAR conference is taking place from 3rd of March to the 5th of March. There are very interesting sessions, and actually interesting sessions on the new POR itself, if you are so inclined to find out more about how we rethink social protection programs, but also learning loss and who is falling through the cracks. Having said that, let me also just raise something as a political scientist. So we are talking about measures, and we are talking about collaboration. We are talking about how poverty is affecting different segments of the populations, right? But as soon as you get into policy, you get into politics in terms of, we can't talk about knowledge being objectively produced and what does it mean and how things have been measured, but whose knowledge counts and how it counts and how it influences policy is political. And that is something that we need to keep in mind in terms of where are the policy opportunities, where can we push issues and narratives, what are the ways of engagements, and what are the ways of working together, but also speaking truth to power. So that's where I will stop. I thank Sanem again for giving me the opportunity to be a part of this session, but also doing such a fantastic job on the CLEAR program. And thanks to my GDI colleagues and also the participants in the conference for raising such useful questions and being patient and sticking with us till very late in the day. Thank you all so much.
Thank you very much, Dr. Solen Asrin, and of course, Mr. Yogesh and my study team. Professor Fielding, Mahatab, and Upasak. With this, we conclude our session today, and we invite you to have tea with us, and then we look forward to seeing you tomorrow morning. Thank you very much. Thank you.